Here.
Commissioner Rogers,
Here.
Commissioner Treese,
Here.
Vice Chair Scouten,
Here.
Chair Harrington.
Here. Thank you, Mr. Moss. The first item on our agenda is oral communications. Do we have anyone signed up to speak with us this evening?
Yes, we do, Madam Chair. We have Mr. Dale Feek. Dale, can you hear us?
Yes, Kevin, can you hear me?
Yes.
We can. Please go ahead for 2 minutes.
Thank you. I'm Dale Feek, representative of 2 nonprofit organizations. I sent a letter to the editor and started with, "Do you know that?" And I sent an email to you with that statement. This is the statements. The small particulate matter that is in wildfire smoke, for which experts recommend that you wear a KN95 or an N95 mask, is the same small particulate matter that Intel Corporation, Washington County emits on a regular basis. Intel emits 2.5 and 10.0 micrometer particles. They're odorless and cannot be seen as wildfire smoke can be seen and smelled. Intel is allowed by DEQ to emit 35 tons of 2.5 and 31 tons of 10.0 micrometer particles per year. EPA says, and I quote, "Small particles less than 10 micrometers in diameter pose the greatest problems because they can get deep into your lungs and some may even get into your bloodstream. Exposure to such particles can affect both your lungs and your heart. Numerous scientific studies have linked particle pollution exposure to a variety of problems, including premature death in people with heart or lung disease, non-fatal heart attacks, irregular heartbeat, aggravated asthma, decreased lung function, increased respiratory symptoms, such as irritation of the airways, coughing, or difficulty breathing. People with heart or lung diseases, children, and older adults are the most likely to be affected by particle pollution exposure," end of quote. I thank you as commissioners in the health department for issuing KN95 masks to the most vulnerable populations, the people who cannot stay indoors, to protect them. Only the KN95 or N95 mask can filter out the 2.5 micrometer particles. Cloth masks and most other masks do not effectively filter out 2.5 micrometer particles. So for COVID-19 virus particles and 2.5 micrometer particles, people please try to get a K95 or N95 mask. Thank you.
Thank you, Mr. Feek. Is anyone else signed up, Kevin?
We do not have anyone else, Madam Chair.
Great, and I don't see anyone here in the room with us this evening. The next item on our agenda is the consent agenda. Tonight's consent agenda consists of 6 items: 3 sets of minutes from September 1st, 2020, our special meeting of September 8, 2020, and our emergency meeting of September 11, 2020, as well as 3 items from land use and transportation, which includes item A, where the reposting of the agenda packet added the link to the bid award memo. What are the wishes of the commission?
Move for approval.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
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 Any opposed? The motion carries unanimously 5-0. Thank you, colleagues. The next item on our agenda is a presentation, a COVID-19 update from our Director of Health and Human Services, Marnie Kyle. And before Marnie starts, I'd like to share just a brief statement from myself. As we all know, our country has now lost 200,000 of its residents. The first certified death of COVID here in the United States was on January 20th of 2020. That's a mere 35 weeks ago. Here in Oregon, our first certified case of COVID-19 was right here in Washington County on February 28th, 2020. That was a mere 30 weeks ago, 529 deaths. I read those OHA emails each and every day and read about the people who have died, most with underlying health conditions, but not all. I know more than 529 people here in Oregon. I may not know them all well, but I know that many people. And I do not wish to lose 529 people. out of my life here in Oregon. So I hope that we as a community can do a better job of reducing the spread of this virus, because you are very important, each and every one of you, and you deserve to live. It is why today I commemorate, I honor these 200,000 deaths here in the United States, wearing the color of mourning, a black dress. Thank you.
Thank you, Chair Harrington and Board. I'll go ahead and, there we go, presentation's up. So I have a relatively quick update for you today, and then we have a guest at the end that is going to give you some more specific information on the impact of access to childcare services at the end of my presentation. So I'm happy to take questions as we go along as usual, so that we can flow right into her presentation. Okay, so as usual, we'll start with the Oregon numbers. So cumulative numbers is up to 30,995, so just under 31,000 cumulative cases in our state. Our case rate, as you might notice from last week, has increased. Last week it was 700 cases per 100,000, and it's 735 per 100,000 as of this week. Cumulative deaths, as Chair Harrington just mentioned, is up to 529. And we have, last week we reported a downward trend in hospitalizations, and this week it's a stable trend in hospitalizations. Next slide, thank you. So now moving to Washington County cumulative data, as normal, I provided last week's numbers and this week's for some comparison. And I'll read the numbers mostly for the people who are in the audience that may not be able to see the PowerPoint, but our cumulative case count in Washington County as of yesterday evening was 4,163. In addition, we have 158 presumptive cases. We've had 329 hospitalizations and 58 deaths in Washington County. For current open outbreaks, and these are not cumulative numbers, these are current outbreaks at this time. So long-term care facilities, we have 15, other congregate settings, 2, workplace settings, 21, and 2 daycare camp settings. Okay, so I wanted to also touch on total COVID deaths by month this week, because we've been looking at the data. And so Washington County, as I said, has had a total of 58 deaths as of the 19th. And 41% of those deaths occurred in August of 2020, and 19% of the deaths occurred in September of 2020. So there was a drop in June, but we saw pretty significant increases in August and September. The large spikes in August are nearly all related to long-term care facility outbreaks. So they were nearly all in older, vulnerable adults. So I think it's just a really unfortunate reminder that this is still deadly.
Do you have any thoughts about, I mean, we talked briefly about, before our meeting started today, about the Labor Day bump and the bumps we've seen in some of the other holidays. I don't know if you're going to have an opportunity to say something, or say something now about how we need to be particularly careful around larger family gatherings or gatherings of friends, and how dangerous are those settings, and are they contributing to those numbers, those terrible numbers?
Yes, so that's a great reminder. When we looked at the numbers for Washington County, and we're going to look at case rates and our opening status in a minute, but I think we can't say it often enough that where we're seeing cases continues to be gatherings. And when we say gatherings, it's things like weddings, it's family events, family milestones, multiple households getting together, in addition to other types of gatherings that are parties or festivals or larger, like weddings, that kind of gathering. So we can't say it enough that this is still dangerous. We still need people to really limit they need to continue to socially distance around people that are not in their household. Okay, so we're on this is the US map. And again, I think that, Oregon, the cases per 100,000 has increased, as well as the deaths per 100,000. So I think you were mentioning this earlier, that there's some different US maps out there where they're showing in the darker the color on the map, the higher the case rate and the higher the death rate. And so Oregon is in yellow. We've been relatively stable, but we have seen that Labor Day bump, which you'll see in a minute. We can go to the next slide. So here's our Tri-County Public Health Phase 2 readiness indicators. And if you remember last week, 5 of our 6 indicators were green. And we were feeling relatively positive about the Washington County numbers last week, but we also were recommending caution in that we needed to see what happens with the Labor Day bump. And a couple of things impacted that. So one is it takes a couple of weeks because of incubation periods. And we were talking earlier about, we have to have the incubation period. A person needs to be symptomatic typically, and then they might go to the doctor for testing. So we don't usually see increases after events or holidays for at least a couple of weeks for that reason. In addition, we had the wildfires, and so a lot of our testing sites closed, especially the outdoor testing sites. And so we did, as predicted, see some increases in test positivity rates. We saw increases in cases that were not connected to known sources, to other cases. And as we've talked, we also have seen an increase in hospitalizations in the last 14 days. So those are trends in the wrong direction again. They're not huge, awful increases. What's really happening is we're just sort of riding right on that line of meeting the metrics. And so we're just sort of bouncing up and down right along the line in Washington County. And you can see that some of the other counties are a little bit, Clackamas County is pretty close to us, but on the percent of cases not traced to a known source, which is one of the most important metrics, Multnomah County is still at 51%. And as you all know, we continue to be tied regionally as far as our ability to move into phase 2. The other unknown that I'll remind you about here, one is the testing just came back online after the air quality improved, so over the weekend and beginning of this week. So we still may continue to see increases from Labor Day. In addition, we are expecting that we might see bumps related to the fire evacuations. So just as an example, we know that there were evacuees from facilities and individuals in Clackamas County that were either contacts in isolation or quarantine, or were positive cases that were evacuated. And so we know some of those people likely came to Washington County, whether they stayed in hotels or with relatives. And so again, I hate to be more of a downer this week than last week. I was feeling more optimistic, but that's how this has been going, really bumping along up and down. Okay. We can go to the next slide. So this is the school reopening metrics, and they are slightly different metrics. The schools need to have a case rate for full in-person school. The case rate needs to be below 10 per 100,000, but for consideration of opening pre-kindergarten through third grade, the case rate needs to be 30 or less per 100,000, and the test positivity rate for both the county and the state needs to be below 5%. So you can see that Washington County is meeting for 3 weeks in a row. The case rate, our test positivity rate bumped up. And all of these have to be met for 3 weeks in a row. And so our understanding of how this works is now we're bumped back. So if next week we meet both metrics, the 3-week would start over. And that's for school reopening. It's not for phase 2. Okay. So this chart, I think I've just kept in and keep updating, continue to say that, you know, we are still continuing to decrease at a slower rate, but we need to remain vigilant, as we've talked about. So I'm going to pause for a minute and see if there's questions about numbers before I move on to some of our main strategy updates around homeless and others.
Commissioner Rogers, do you have any questions?
No, thank you.
Commissioner Treese? Commissioner Willie?
No, I don't think so. I'm a little frustrated by the results, but I don't have any questions.
Commissioner Scouten?
Yes.
I like this slide that shows me the data from last week, the epi curve anyway,
Yeah.
compared to when we entered phase 1.
Yep.
But still needs to go down.
Yep.
And phase moving to, well, we're in, I guess, maybe you'll get to this, but I reminded myself, we're not fully in phase 1. We're in phase 1 with restrictions still, right?
Well, we are in phase 1. However, over time, there has been slight changes to the phase 1 guidance. So the governor's office has made changes to the guidelines and recommendations for how businesses can operate during phase 1 and what businesses can operate during phase 1. So there has been changes to the guidelines, but we are still in phase 1.
But the chart that they use as the guidance tool still has some venues being able to operate at a crowd gathering of 250, yet
Yes.
she put restrictions in that limited both inside and outside gatherings
Yes.
to lower than that. So that's why I've been thinking of it as phase 1 with restrictions.
Yes. Sure, I'm sorry. I mean, I think of it as phase 1s with updated guidelines, but either way, yes, there's been changes along the way, and I'm happy to bring that chart and kind of help walk through that a bit to talk about some of the changes that were made to the guidelines.
They haven't updated the chart since July 24th.
Right, I'm
so-
just trying to think if there was, I think most of what's coming to my mind without looking at it is there's been reductions in restrictions versus added restrictions, but I might be not thinking about something.
All right. Well, nonetheless, what this chart reminds me of is that we need to make a little bit more progress. And with phase 2, we have more flexibility and more venues, more places that get to operate,
Yes.
which would loosen things up even more. And we don't want to have to backtrack.
Right.
So the better we can do in advance of getting to phase 2, the better off we'll be.
Yes.
Because that will show that our behavior has changed.
And I think as we move into phase 2 and towards phase 2, the important message is going to be, that doesn't mean it's over. It doesn't mean we can stop worrying about physical distancing. It doesn't mean we should stop wearing our face coverings or hand washing. It just means that we can cautiously open more businesses and have more social gatherings, again, with all those other caveats of face coverings, hand washing, and physical distancing. Yes,
Limiting your exposure.
yes. Okay.
Thank you, Marnie.
We'll move into the couple different strategies. So we'll start with the homeless COVID prevention update. You can see the numbers up there. The hotel voucher program has currently 20 people enrolled. Safe Sleeping Village has had 66 total participants. Right now we have 43 participants. We have 7 vacancies, which we think will be filled pretty quickly because we have a waiting list. 23 people have exited the program since they started there. And we checked on, why they've exited, and there's just all sorts of reasons. Sometimes it's because people don't want to follow the rules. Sometimes it's other reasons. We had one person that did have a medical issue that was taken to medical care. So just all sorts of different reasons. Just as a reminder, during the poor air quality days, we did have the participants move to the respite shelter at the Comfort Inn and Suite. They were there until Sunday because not only was there poor air quality, but between the winds and the rain, I think I mentioned that many of the tents were damaged. So they were moved back on Sunday, and that went relatively smooth. But we also lost a few people during that move back. So I think just the changes in moving back and forth is stressful for folks. So, and then Family Promise Shelter is currently serving 70 folks. And then I wanted to let you know that we're also developing a program you've probably heard about or seen complaints or driven by, the RV parking that has accumulated by the ball fields near the West Side Commons. And so we're working on a plan and really hoping in the next couple of weeks that we'll have a plan in place to develop some support and programs. So it'll include things like fencing around, some security. We'll also do some screening. It probably won't be at the same level as the Safe Sleeping Village, but we will do screening of folks for COVID symptoms, temperature checks, make sure they know how to access services or what to do if they do develop symptoms, make sure that they have face coverings, hand sanitation facilities, all of those kind of things. So it'll be a little bit more limited than the Safe Sleeping Village, but making sure that they have services and that we're really trying to provide support to that community as well as the surrounding neighborhoods. So that is in the works. So I just wanted to make sure that you knew that. Okay, so the big question. Again, this really has not changed since we talked last time. We are continued to be tied to Multnomah County. I know that is, if we had our choice, that's probably not what any of us would want. But we are tied regionally to Multnomah and Clackamas County. We continue to have conversations with OHA and the governor's office, and I'll say it really hasn't progressed much since last week because they were really slammed and then recovering from the wildfire situation and the poor air quality days. So I don't really have any new information. Today, our data supports that we're meeting 3 of the six metrics, so not as good as last week. But labs are back online. We are seeing, as predicted, the Labor Day bump. And as I already talked about, we won't know exactly about the fires for another week or so, week to 10 days. So I want to leave you any space for discussions or to air your frustrations. I know we're all feeling really tired of this.
Well, I guess we can take the positive spin. At least the air quality is a whole lot better. Yeah. By the way, thank you for your words, Chair. I thought that your comments about the national death toll and what's happened here in this county was, it was very moving, so thank you for those words.
Thank you. Commissioner Willie, any questions or comments?
Yes, I just want to go back to a comment, Marnie, that you made about the long-term care facilities and how much impact on the data are these facilities, I guess, kind of putting a negative turn on the rest of the numbers. So if we would take out the long-term care facilities numbers, would that change our numbers at all?
Well, certainly, because we're looking at case counts, which contribute to the case rates. They are higher risk, more vulnerable, so likely hospitalized more often, and they're dying. So, but I guess I would also say that one of the reasons we're concerned about cases in the less vulnerable, medically fragile population is because of the impact on our older, on our, our grandparents, our people that are in these long-term care facilities. So yes, if we didn't have any cases in long-term care facilities, that would reduce the number of cases and hospitalizations and deaths. I'm
Well, I
not sure
think
if that
we're all-
answers your question, but.
Well, it does answer my question, and it kind of emphasizes my point. That's a controlled environment. Whereas people who went out on Labor Day and who socially go out and party and those kinds of things is not a controlled environment. So I'm just trying to identify specifically, I guess, differentiate specifically the long-term care facilities and how much impact they are having on our data, which when blended in with all the other data, then creates a negative, a red number, and therefore restricts our ability to move into phase 2. So I'm just trying to make sure that I can, I guess, separate those, because to me, like I said, the long-term care facilities is a controlled environment and has really very little impact on all the other social aspects where there are positive cases. So again, I want to be able to identify where the problems are.
Right. I guess what I would I don't want to come across as defensive or argumentative, but it's, I think, when you think about kids going back to school or to socialize with their friends or family gatherings, and then you think about the percentage of cases that can be transmitted that have no symptoms. And if, I don't know, if I worked at a long-term care facility and, my child or teenager had COVID, gave it to me, I don't have symptoms, and now I'm working inside of a long-term care facility. So it's really hard to separate out because they are a controlled environment to some point, but in their screening staff, they're using face coverings, but it's still a high-risk environment because they have fragile immune systems. They're more medically fragile when they do get sick. So it's just really hard to separate out. If everybody's not staying home and staying safe, then there's more risk of the people that do work in the long-term care facility, whether they're nurses or administrators that are bringing it in, or janitors, any number of people that are coming into that facility could unknowingly come in with no symptoms, and the screening that they're doing might catch somebody if they have a fever or symptoms, but half the cases are transmitted from people that had no fever and no symptoms, no known symptoms. So it's just difficult to pull that strand of hair apart.
No, and I'm perfectly fine with you not agreeing with me. So you can tell me, take a hike, whatever. But again, if we segment that part out of the testing, because we're holding all 100% of our environment accountable to these numbers before we move to phase 2, when we have identified a significant small portion of it being a determinant to our numbers being negative. So I'm trying to say, while I don't want to deminimize long-term care facilities and all that, and I certainly don't want to deminimize the folks that are at risk, but at the same time, I'm just concerned that we use those numbers, and those numbers have a significant impact on the overall impact, and it restricts our ability to even consider moving into phase 2. Forget about Multnomah and Clackamas County, just our numbers. So I don't think our numbers are all that bad if we do that, but I could be completely wrong.
Yeah.
So convince me.
Yeah, I understand what you're saying. And it's convinced the governor's office that we need to change the metrics too. But
Well, what I'm hearing from you, Marnie, is that when the cases, it's hard to really separate out those two categories, and if we see some increases on the outside, it's going to leak into the long-term care facilities with really deadly consequences, because that population is particularly vulnerable.
I mean, we can certainly separate the data, and I understand what Commissioner Willie is saying is, looking at the reopening criteria where there could be some benefit in separating the data. But I in my opinion, that could put our older population at risk. But that, I'm not the epidemiologist and I'm not the governor, so he also makes a good point, because they're more isolated than the rest of us.
But they are nonetheless still affected through the general population, because it wasn't that long ago that we allowed family and general visitors back to long-term care facilities, people who are mixing in the general population. Even folks who work in long-term care facilities, they still have to go to the grocery store, even though they're monitored, right? And you've taught me, and the epidemiologists have taught me, that you can be contagious, the most contagious, 3 days before you show any symptoms. So it's still early going with this virus.
And it is frustrating. I mean, we'd all like to move into phase 2, because we know that there's also a lot of suffering, because we can't move into phase 2. So I don't want to sound like I don't understand that and hear that and know that. I think we all understand there's suffering on both sides.
Well,
Yeah.
Commissioner Treese or Commissioner Rogers, do you have any questions up until this point? Nope. Okay.
Okay,
I
so
just want to say thank you to Marty for this work. And yes, I'm frustrated like everybody else, but I think that we have to live with the reality that we have here. And, this is just a message that we continue to put in front of the public. And that is, we have to be, as you've said, Chair, vigilant. And we're not out of this, and we won't be for a while.
Yeah.
Yeah. My only comment is it is frustrating, and we keep giving bad news to people. I feel a little bit like the Peanuts cartoon where, Charlie Brown is always going to kick the football and Lucy jerks it out about the time that he runs up and kicks it. Not any of our fault. We have to practice best science. But sometimes I wonder whether or not telling people over and over again bad news is the right thing, or simply say it's, until we have changes, that's what it is, and stay the course. But I'm just thinking out loud. The other point is that I understand fully what Commissioner Willie is saying. He's looking at it from a number standpoint and saying, if we were taking that select group who is in a more isolated situation, and we were to extract them from the totals, it would somehow change. But I also get the issue about people are moving around. That's why there's the difficulty in all this. There's no national standards. And if you go to Arizona, you go to Texas, you go to other states, they have completely different criteria. And so they're opening at different rates. Now, I'm not saying that's right or wrong. We all have to make our value judgments and take our risks. But that's what people are just not quite understanding from state to state. But Marnie, just give us some good news some point. I just want good news.
Well, our color's
working on it.
a lot lighter on that national map than it is to the states you just referenced, like Texas and
Yes.
Arizona.
For sure.
Yep. Very true. I'll work on the good news.
Thank you.
Yeah.
The good news is we're looking at and talking about striving to reopen and apply for phase 2.
Yes. Okay.
And once again, this isn't Marnie's the messenger, and we recognize that.
Yeah.
Well, we're not going to shoot her, don't worry.
No.
Oh, thank you very much.
And I feel very safe, so. No, I appreciate all of you. It's really good discussion. It's important discussion. And I really do appreciate your willingness to continue to have the conversations. So, I'll move on. Oh, so school-aged learning support and childcare. I don't really have any big updates. We continue to, actually today, the number of verified applicants went up a bit. And they're still receiving applications, so that's going in a good direction. That's good news. We're getting some funds out to our child care providers. And then on the school district early learning support program, the biggest change is that Hillsborough's board did approve the IGA, so that contract should be getting out the door in the next couple of days. So that's also good news. Beaverton and Tigard Tualatin are still in process, so they're interested and they're planning to move forward. It's just more of a iterative process and looking at the IGA and coming to make sure that everybody has a complete understanding of that. So at this point, I wanted to turn it over to Karen Hinkenmeyer. She's the Child Care Resource and Referral Manager at Community Action of Washington County. She did a presentation earlier this week that Commissioner Willie was able to see, and he thought it would be really helpful for us to just sort of as a reminder to understand the impacts of COVID has had on our child care system. So I will turn it over to Kevin to get Karen all set up, and I see her, so that must be a good sign.
Hello, everybody. My name is Karen Hinkenmeyer. I work for Community Action Agency, and I manage the Child Care Resource and Referral Program. I'm here to talk to you about not such good news either. But there are some really silver linings in all of it as well. So just to tell you a little bit about, can you go to the next slide, please? And just click it again so the map shows up. Thank you. So Child Care Resource and Referrals, we are funded primarily from the Early Learning Division. And so there's 13 of us in the state of Oregon currently. And I oversee the Service Delivery Area, or SDA, of Washington County. And since there are 13 in the state, they are housed in different entities. There are 3 that are in community actions in the state, and then others are in community colleges or education service districts. So we are different in each service delivery area. So what we do is offer a variety of professional development supports and technical assistance to all types of early educators in Washington County. So that ranges from your family, friends, and neighbor individual that cares for maybe their grandkids or their neighbors that are license exempt, as well as certified child care centers, Head Start, family child care. So the gamut of childcare, we are the local expert in connecting early educators to a comprehensive range of resources and educational opportunities. Thank you for moving that. So pre-COVID-19 childcare landscape. So it's not a good picture. Washington County is in a child care desert for children ages 5 and under. And what that means is for every 1 licensed child care slot, there are 3 children looking for that slot. I do have links about what Oregon's child care desert's more specific information, PDF, and then the interactive child care map. In this PowerPoint, if you'd like to look at that at another time. So the next slide. So in Oregon, all of us in Oregon are in a desert, a childcare desert for infants and toddlers. We are at 8 infants and toddlers for a single childcare slot in the state of Oregon. And there are parts of Washington County that have 12 children, infants and toddler age, that are needing childcare with just 1 slot. So in Washington County, we have only 10% of our publicly funded programs care for children under 5. And so that's an area in which we are definitely lower than many other counties in the state. So that will be increasing. We do have some additional preschool promise sites that will be opening up here in the fall, and we look forward to that. Next slide, please. So here we have an already fragile child care system, not only in the state of Oregon, not only in Washington County, but in the nation. And when COVID hit, Governor Brown said, okay, stay at home, save lives. And what that meant for us as childcare is you had to close your childcare facility unless you received specific approval from the Early Learning Division, Office of Child Care. And then you were approved to operate an emergency child care program. So in order to be an emergency child care program, you had to have stable groups of children and prioritize child care needs for first responders, emergency workers, healthcare, and other essential personnel. In addition to that, you had to follow very specific health and safety guidelines, which was an increase of costs for providers. So emergency childcare. A significant amount of programs could not comply in the beginning right away in April to comply to be an ECC because of loss of clients, loss of space, lack of PPE and sanitation supplies. Sounds like somebody's at the door.
We love your coworker.
Yeah, right, Mario is my coworker. For a time, we lost a little more than half the
Where's
supply.
Bonnie Hayes?
client providers scramble to meet the new COVID health and safety. I'm just going to pause for 1 second to see if I can get him settled.
Yeah.
We have all been there.
Yeah.
Oh, yeah, life in the age of COVID.
Yeah.
Not a problem.
No kidding. Yeah, if it might be a dog barking, it might be a child crying, it could be your spouse, your significant other, whatever.
Yeah. Welcome back, Karen. Not a problem at all.
Oh, sorry.
No, you're fine.
So go ahead, next slide. So, so our task change as a child care resource and referral to support programs in a different way than just training and professional development. So what we started to do is recruit and assist providers to apply to be emergency child care. We also did updating of the program so that we had a statewide database that had availability for parents to access child care referrals. And then we also supported providers with personal protective equipment and sanitation supplies that we had at a state level. And then now we have that also as a local level, which is amazing. So we did a lot of outreach, input, and support with the ECC guidelines to help support individuals to understand them. We connected providers to COVID-19 relief funding opportunities. And we continue to provide professional ongoing professional development trainings for licensing requirements. And the next slide. So childcare capacity. Pre-COVID, we had 632 licensed facilities. We had 126 license exempt facilities. Total capacities, almost 19,000 and over 3,500 for vacancies. So currently we have 527 licensed facilities that are up and running, and then 11 exempt facilities. So we are down significantly in our total capacity, but we are reaching day by day, getting better at reaching the total vacancies for families. So in the state of Oregon, in order to find childcare, if you could go to the next slide, is 211 info. So we are the supply of childcare. We help supply it. And then the demand goes through 211 info. So families are directed to 211 info. They can text, email, or call. It's open 7 days a week, and also extended hours. Parents can also look online on their own to find childcare. And then we also have a childcare safety portal in which you get a list of providers that could possibly work out for you. And then you go through that safety portal and you can see if there are any valid complaints or issues in regards to that licensed facility. So that helps parents decide on what quality means to them. And then the next one. For families, one amazing thing for families is that Oregon Department of Human Services changed their ERDC subsidy program so that you could make more money as well as not have a copay for 12 months and get supported with the ERD subsidy. So the income limit that is increased, if you could go to the next slide. These are the eligibility limits, and they're quite high compared to what they were. They were about, for a family of two, around 2,000. So more families can access ERDC. And in addition to that, they have a $0 copay for 12 months. So that's a really huge benefit for families. And we're trying to get the word out as much as possible to school districts and community partners to have families know that they call 211 info to get a list of referrals, and also to apply for ERDC in case they're eligible.
Karen, quick question on this slide. The
Mhm.
number in ERDC group, is that the number in the family?
Yes.
Okay, thank you.
Yeah. So the number in a 2 group would be the parent and child. And then 3 is parent and 2 children, or 2 parents and a child.
Thank you.
So that's my presentation with, we've got information there. That's a link to our website where it's got loads of information, links to the Early Learning Division, COVID-19 resources, health and safety guides. And in addition, you can always email or call us for information or send me an email. This has been an opportunity, a great opportunity, and I so appreciate you asking me to come speak to you, because childcare is such an important topic right now, and our families are in dire need of support.
Thank you, Karen, for your heroic work. Commissioners, any
I
questions?
just want to express my appreciation to Karen as well, and for your work with the child care group, for everything. So thanks for this presentation and keeping us up to speed on what the child care issues are.
Thank you for listening.
Commissioner Rogers, questions or comments? No? Okay. Commissioner Willie?
Yeah, I just want to say thank you to Karen and Community Action for all the work that they do. That's the reason I wanted to get you in front of the commissioners, because you had that data that is so revealing and so absolutely important when I know that as a county, we have been focused on trying to find ways that we can support the child care industry and get more available spots to help our workers, not only the county workers, but the private sector and certainly the school. And so we know that you're working really hard to do that. So I guess my question might be, how can we better help you in doing that? And how can we get the word out? I mean, maybe we use much more social media or something, but I'd like to think certainly our most vulnerable families certainly need to hear this, and I'm hoping that we are getting the word out to them. But so help me out on that. How can we do a better job?
Well, I think it would be great. Well, first of all, Washington County is probably doing the best job in the state in supporting childcare, and for that I am incredibly grateful. And when it comes to working with those that are farthest from opportunity, that's something that we strive to connect with providers that speak a language other than English, to support them in getting the professional development that they need in order to be licensed and stay licensed, because you need continuous quality improvement trainings. So what one of the biggest things I think that would help the work that we do is supporting getting trainings translated into languages other than English. And that would be some Spanish, but we also have a great need for Somali and Arabic, as well as Vietnamese and Russian. So that's something that I really feel that would help benefit and help create a stable capacity of childcare that's culturally appropriate. But the funding, the ECC grants are amazing. This county has been so supportive of childcare in so many ways. And I think just better having more supports for family childcare providers is one of the things that we do a lot of, and we provide childcare networks. So we group family childcare providers together to do intensive, intentional training and support, where it creates a really a great peer learning experience for them. And that's something that we could always do more of.
Well, I just want to say thank you again for what you do, and you have such a broad brush across the county, and certainly supporting our diversity and our minorities. And yeah, I want to work more in partnership with you. We've got some CARES funding that we need to be focusing on. So if you've got some ideas on how we can do a better job with that, please let us know. So thank you again for what you're doing, certainly for being here tonight.
You're welcome. Thanks
Commissioner
for having
Willie.
me.
Thank you, Commissioner Willie. Commissioner Treese and I are active participants with the Child Care Work Group, and we, in fact, have ideas in hand, and I believe have asked staff to follow up with our CAO. So glad to hear your support. Commissioner Scouten, anything?
No, thank you for the presentation. And thank you, Commissioner Willie, for kind of putting this together for us.
Thank you, Karen, once again for your presentation. We on the board had information last year from the state study. I brought that to my colleagues' attention. Your presentation today is helping for some to connect the dots to ensure that in order for us as a community to move out of this tough economic time as a result of this COVID pandemic, that we need to do everything we can to help our families and the youngest members of our community. But even after we get through this public health crisis and the economic crisis, we had a drought before 2020. And so we need to continue to improve the access to good education and health care of all types to members of our community. We have an awful lot of community need. But what you have today here with the Washington County Board is an engaged board that continues to be on the journey of examining community need and to look at programs and investment decisions that we can make to advance everyone's life here in Washington County, as well as our economy. So thank you for staying healthy. I don't think we have any additional questions or comments for you. We hope you have a good night.
Thank you.
I just want to
too.
know your dog's name.
Mario.
Mario.
He's 11 and very, very happy and excited.
Well, thank you for sharing, Mario.
Sounded like a Mario.
Thank you.
Do you have anything else, Marnie?
Nope, thank you.
Okay, great, thank you. The next item on our agenda tonight is board and commissions. We have a slate of folks to appoint to the Board of Property Tax Appeals. We have information in our packet, but I'm just checking to see if we have a staff report.
Chair Harrington, there is not a staff report.
Okay, so we have a recommendation before us to appoint Alan L. Ross as a new board member to the Board of Property Tax Appeals. In addition, we have 4 members who are seeking reappointment: John Junkin, Anthony Mills, Darlene Dick, and Patrick McGuire. What are the wishes of the commission?
Move to accept the recommendation.
Second.
All those in favor, please vote by saying aye.
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 Any opposed? The motion carries unanimously 5-0. Thank you, colleagues. Next on the agenda is oral communications. Kevin, do we have anyone signed up?
We do not, Madam Chair.
All right. Seeing none, we'll move on to board announcements. And as usual, I'll start. Next Tuesday, September 29th, we have a work session at 8:30 in the morning and a board meeting at 10 a.m. Then we move on to the month of October. The board will have a roundtable on Thursday at 10 o'clock. And then we will not have any other Board of Commissioner meetings until August 13th.
Or October?
Excuse me, thank you, October 13th, because this board will be participating in the WEFTEC conference albeit a virtual conference this year, but nonetheless, it is an important industry conference for the work we do as the Board of Clean Water Services. Then, following on October 13th, thank you for catching my mistake, we'll be meeting on Tuesday, October 13th, a work session starting at 8:30 in the morning. Are there any other board announcements today? Seeing none, do we have a motion to adjourn tonight's meeting of September 22nd?
So moved.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye. Aye.
Any opposed? The motion carries unanimously, 5-0. Good night, everyone. Stay healthy.